Hi, everybody. Just preliminarily, this is a brand new law. And the changes to this are rapid and developing. We're going to give you our best information as of now, but it's a rapidly changing environment. Reese is going to do this presentation, and I am going to pop in from time to time to give a little update from some things or to make a little commentary. One thing you should know is that those employees up to 499 count only those in the USA, including USA possessions or territories, and not any employees located in other countries. Also, the counting happens as of the day an employee needs to take leave under the Act. Thanks.
Now, one of the things that's important to understand is that the employers actually pay for the leave. Now, Congress has said that there will be reimbursement up to 100% by the IRS. It's an immediate dollar-for-dollar tax offset against payroll taxes. And where a refund is owed, the IRS will send the refund as quickly as possible. The latest information suggests quarterly, and the IRS has conveniently provided a form for everybody to fill out. It's IRS Form 7200. And it's actually, for an IRS form, relatively easy to follow. I looked at it this morning. It didn't seem too complicated. Now, one of the things as an employer, just like any other employment law, there has to be notification from the employer to the employees. And DOL has provided a poster about the sick leave. Now, you can also do an email distribution of the poster. You can find it as a PDF on the Department of Labor's website. And ours. And it's very detailed. Next slide, please. Now, what is covered under the Act? Well, first thing is paid sick leave. Now, full-time employees are eligible for 80 hours of paid sick leave, which is 2 weeks. And part-time employees are entitled to an equivalent of 2 weeks paid leave. Now, how do they do this? They take 6 months history and they average it out. So if you have an employee who has been working 30 hours 1 week, 0 hours the next week, and that seems to be the repeated pattern, it comes out to be 15 hours when averaged out per week, which comes out to 30 weeks total for the 2 week period. Now, if you have an employee that has started before the 6 month history starts, the averaging starts the day the employee started working for you.
Hey, Reese, I think you might have accidentally muted yourself.
Hi, this is Peg.
Oh, there we go.
Can you hear me now? Sorry. In very recent guidance, the U.S. Department of Labor has told us full-time employees are only those working 40 hours a week or more. So if you've got a 35-hour-a-week standard for your full-time employees, under this statute, they're considered part-time employees, which is fine because you just pay them 2 weeks of their regular pay, of their regular hours for the week. So if you pay them 2 35-hour weeks that's going to be fine. Okay, thank you.
All right, I'm back. And one of the things that I think employers should be very aware of is that if you have employees that have previously accrued leave, such as PTO, sick leave, etc., an employer cannot force the employee to use that sick leave prior to invoking the act or the leave that they're entitled to under the act. Now, this doesn't mean that if the employee wants to, quote unquote, topping up with PTO or other leave, they're more than all right to do that. It just has to be their decision and not the employer's. Next slide, please. Paid sick leave only applies when the employee is sick. So what's everybody getting? Well, if you're a full-time employee, your regular rate up to $511 per day, or a total of $5,110 if, and this is important, if that employee is unable to work or telework because of these three criteria, right? 1, the employee is subject to a federal, state, or local quarantine or self-isolation order because they're suffering from the coronavirus. Important thing to note is that, as we all know, the state of Connecticut is this basically on a lockdown, no unnecessary travel. That does not count. What counts is if the employee is specifically told that they cannot leave their home or they have to self-quarantine because of they are showing the symptoms of COVID-19. It's also important to remember that this does not apply, this does apply, excuse me, this also applies to part-time employees as we discussed previously, all right? Now, the second issue is if the employee is advised by a healthcare provider to quarantine or self-isolate because of COVID-19 concerns. So if a doctor has told somebody, or a nurse practitioner, or other medical professional. Finally, the third one is if an employee is experiencing COVID-19 symptoms and they go out on their own to get a medical diagnosis. They go talk to a doctor saying, I think I have it. Please let me know. And they're seeking medical attention. Next slide, please. Now, there are other situations where an employee is eligible for either 2/3 of their regular pay or the minimum wage, all right, whichever is the greater amount. So if you have a part-time employee that is making a minimum wage, that is what they're entitled to. However, if you have somebody who is making more than minimum wage, they're entitled to 2/3 their regular pay if that 2/3 is greater than the minimum wage. Now, the maximum they're entitled to is $200 per day, or $2,000 total, if one of these three criteria are met. 1, the employee is caring for an individual, such as a loved one, close family friend, who has been quarantined or advised by a healthcare provider to self-quarantine. The employee is caring for a child when the school or the place of childcare is closed, or their normal childcare provider is unavailable due to COVID-19, and they're unable to work or telework because they're caring for their children. For instance, if you have somebody who teleworks normally and their 17-year-old son just happens to be out from high school, they probably do not qualify because they can still work, because the high schooler should be able to watch himself. Now, there are exceptions. For instance, if you have somebody who's caring for a disabled child who happens to be in high school, that would be a different situation and a different scenario. The final scenario is if the employee is experiencing any other substantially similar condition as specified by the Secretary of Health and Human Services in consultation with the Secretary of Treasury, the Secretary of Labor. For instance, there's some other issue that comes up during the next several months that results in a similar situation as what we're going through with the COVID-19 pandemic. Next slide. Now, emergency family medical leave, all right? As many employers might know, there's what's known as the Family Medical Leave Act, the FMLA, which provides under certain guidelines the ability for an employee to take time off due to injury or a family emergency such as the death of a parent or another loved one. Oh, sorry, care or illness. Pardon me, for the care of another family member. This is an extension of this. This is the emergency family medical leave. And an employee is entitled to this if they've been employed by the company for at least 30 days and they cannot work or telework because they are needed to take care of their children due to the child's school or care center being closed, or if the care provider is unavailable due to COVID-19. Right now, we seem to be in that situation because all the schools in the state of Connecticut are closed. So the fact that somebody's younger children are home and they're preventing them from working, they should be able to qualify. Now, what's provided under this? Well, first 10 days are unpaid, but after that, the employer is obligated to pay full-time employees 2/3 of the regular pay up to 10 weeks. And part-time or irregular scheduled employees are paid 2/3 of the average of the previous 6 months. The pay cap is capped at $200 per day, $10,000 total.
Hi, everybody. It's Peg again. I just want to emphasize to you that even though you may be too small an employer to be subject to the Family and Medical Leave Act on a regular basis, this Emergency Family and Medical Leave Act will apply to you if you are 499 workforce or smaller. If you are already an FMLA covered employer, you have to figure out how this new part works with what you're used to. Some of the differences are, as Reese just mentioned, it goes to folks who have been with you only 30 days. And it has a paid aspect to it for leave that is taken for these reasons. Okay, I'm going to let Reese go on now. Thanks.
Next slide, please. Now, one of the things that have come up when you look at the DOL regulations, the guidelines, is what happens if I've already used my FMLA leave. For instance, if you have employee Joe who happened to be skiing, broke his leg a couple months ago and took 3 weeks of FMLA leave as he recovered from his injuries, he wants to know, can he tack on the new 10 weeks that he gets? Question is no, or the answer is no. What you have to do is you have to deduct what has been used prior from the amount that the individual is eligible to use under the Act. So employee Joe, he's already used 6 weeks. You'd only be entitled for 4 weeks of paid leave at this point. Now, what about previously accrued PTO and vacation pay? Employees can use this on the first 10 days of their unpaid leave. So if you happen to have 10 days of leave already saved up this year, when you need to go out on FMLA under the Act, you can use that. Now, the other interesting caveat to this is that you can combine the two sections of the Act. For instance, if, as you recall, you get 10 paid days of sick leave, you can use that in conjunction with the FMLA leave. So a full-time employee would get 80 hours at their regular rate for the first 2 weeks, and then they would have 2/3 pay for the rest of the time that they're on leave. Part-time employee would track similarly, except that it's aggregated out at their regular. Next slide, please. Now, there are exemptions to this, which makes a lot of businesses happy. Now, if you happen to be an employer of 50 or less employees, you can claim an exemption from the family medical leave, not from the paid sick leave. All right. In order to do that, you must meet several criteria. All right. One, the provisions of the paid sick leave or the expanded family medical leave would result in the small business's expenses exceeding their obligations available under their business revenues and cause the small business to cease operating or at a minimal capacity. The absence of the employee or the employees requesting the sick leave or expanded family medical leave would create a substantial risk to the financial health or the operational capabilities of the small business because of their specialized skill, knowledge of the business, or responsibilities. Or finally, the third reason is there are not sufficient workers who are able, willing, and qualified and who will be able to be placed to perform the labor or the services provided by the employee or the employees requesting sick leave. And these labor or services are needed for the small business to operate at a minimal capacity.
Hi, everybody. That exemption for getting out from under, if you will, the child care-based paid leave is not self-executing. This is something the Department of Labor must grant you. So what they are now advising is that you gather together the data you need to prove the qualifications that Reese just went through, and hold on to it, because they are going to soon issue a way for people to make application for this exemption. Thanks.
Next slide. Now, here are the other really important one that you should consider. Exemptions, there are exemptions for healthcare providers and first responders. And unlike small businesses, these can be excluded from both the Sick Leave Act and the Emergency Family Medical Leave. Now, what's a healthcare provider? And the family medical for childcare. These are the issues, as stated before. Small businesses only get the exemption for the child care provisions when you're unable to get one. Now, who's a healthcare provider? This is anyone who's employed in a medical care facility, pharmacy, medical library, laboratory, nursing facility, or home, or similar service. Government's even, or DOL has even included medical schools for this. Basically, anybody who works in the medical industry. The second group that falls under this is any business or entity providing services, producing medical products, or otherwise involved in COVID-19 related medical equipment, tests, drugs, vaccines, diagnostics, vehicles, or treatments. If anybody saw the Today Show this morning, You saw there was a segment where they talked about a gentleman down in Texas who's making these helmets that are ventilators. And he would actually fall under this because he's producing a COVID-19 related medical equipment. Another organization, I guess 3M would not, because it's over 499 employees. But if you were to have somebody who was making face masks that were similar to the ones that everybody's trying to find, they would also fall under this exemption if they employed 499 or less employees. Now, the other group that falls under this exemption are first responders, all right? And these are employees needed for the provision of transport, care, healthcare, comfort, and nutrition of COVID-19 patients, or whose services are needed to limit the spread of COVID-19. Generally speaking, this covers a lot of government workers, such as the military, prison guards, fire, police. However, there are private ambulance services, private hospitals, nurses working there. Those people are being considered first responders for purposes of this exemption. Now, the other caveat to this is the highest official, i.e. Governor Lamont in the state, can also decide who's a first responder. For some reason, I don't think he's going to say lawyers, but you never know. Next slide, please. There's one previous to this one. I think we went too far. Yep, there we go. Government employees. I don't know if we have anybody from the, remember the government entities in the state, town, or federal, but if there are, there's a shout out to you all. Government employees generally are eligible for all paid sick leave. Now, the OMB, which is the Office of Management and Budget, I'm sorry, I had a momentary brain freeze there, can exclude certain categories of federal executive branch employees, so those who work in the executive branch, for instance, military, the IRS, the FBI, etc. Now, emergency responders and healthcare provider employees can also be exempt at the employer's option. So this means that the municipalities sometimes can make the decision of whether to exempt their emergency responders and healthcare providers from the eligibility under the Act. Now, what about family medical leave? Fun fact, generally speaking, non-federal employee public agency employees are entitled to a Family Medical Leave Act. However, the majority of federal employees are not. If you are a federal employee, I recommend you talk to your supervisors and determine your eligibility. Emergency responders and healthcare providers, once again, can be exempted at the employer's option. I think Peg has something she wants to say.
I am a chatterbox. I think the big takeaway for any government employers that we have out there on the local level is that there's not the number of employee qualification. So even if you have over 49 employees, you may be subject to this. Thanks.
The next slide, please. Now, as an employer, what's your obligation to those employees who are coming off leave? Now, in most cases, this is very important to remember, you have an obligation to restore a returning employee to the same or an equivalent position upon their return from the leave. All right, you cannot use the fact that they went on leave to fire them, discipline them, or otherwise discriminate against them. More importantly, you can't also discipline somebody who's filed a complaint or initiated a proceeding under this law against you, and you can't also have an adverse employment action against those employees who have testified in a proceeding. For instance, if you have two employees, employee A says that when I came back, I was mistreated because I went on leave, and they reported to the Department of Labor, and the Department of Labor has a hearing, and employee B is asked to testify, and they do testify in the Department of Labor proceeding. You can't sanction employee B. You can't sanction employee A either, but you really can't sanction employee B. Next slide. Now, one thing that's going to come up, I think for a lot of employers, we've seen the economy tank the last couple of weeks. And there are a lot of companies that are making very tough choices. That includes layoffs. And one of the things that we need to be aware of is that an employer can still have layoffs and end an individual's on leave's position if they have a legitimate business reason for doing so, such as a worksite closure, the plant isn't operating anymore, they just can't afford any employees. If they have a legitimate layoff, they can lay off somebody who is out on leave. Now, if a business has fewer than 25 employees, so small businesses, or the employee in question is a quote unquote key employee as defined by the Department of Labor. And if you go to the Department of Labor's coronavirus questions and answers, which you'll see referenced later in this presentation, there's actually a discussion about who a key employee is. Generally speaking, they're decision makers or people that the company can't operate without. If the employee took leave to care for a child because of childcare, but the school is unavailable due to COVID-19, and all of the four following conditions are met, they can lay that employee off. The position no longer exists due to economic or operating conditions that affect employment and due to COVID-19 related reasons during the leave period. The employer makes reasonable efforts to restore the employee to the same or an equivalent position. The employer makes reasonable efforts to contact the employee if an equivalent position becomes available. And the employer continues to make reasonable efforts to contact the employee the earlier of either 1 year starting either on the date the COVID-19 related leave concluded or the date 12 weeks after the leave began. And the final qualifier is the employer makes a reasonable effort to contact the employee if an equivalent position becomes available. If they do all those and they do have to let somebody go, they should be protected. Next slide. Here's the fun part, penalties. What happens if you violate the act? Well, you face the same liabilities as you would normally under the FLSA, which is the Fair Labors and Standards Act, which is the national minimum wage and law and overtime law, and the FMLA. All right, you face civil fines and penalties from DOL, and more importantly, depending on your point of view, civil liabilities to the employee for back and front wages, liquidated damages, and your employee's attorney's fees and costs. So if you were to face, you're accused of facing a violation under the act, and your employee brings a lawsuit against you and you lose, not only do you end up paying your lawyer, you end up paying their lawyer. And nobody really wants to be in that position. But there is one little ray of sunshine here. You have a 30-day grace period for good faith violations starting April 1. All right, so as of Wednesday, you have a 30-day ticking clock in which to make good faith mistakes. If it happens to be made in bad faith, you are going to be in trouble. But right now, the DOL is more concerned about educating companies and individuals about what's going on in regards to the act than actually punishing them. Starting May 1st, though, the good faith violation is not going to work because you're not going to have a 30-day grace period anymore. And DOL is going to be hitting this, I think we believe, hard. There's going to be a lot of questions because, as Peg said at the beginning of this presentation, this is a brand new law and there's a shifting goalpost. They keep moving things because DOL is trying to keep up with what's happening, and there's only so many government bureaucrats to interpret the law, and that's one of the reasons why we have the 30-day grace period, because they are issuing new guidelines every day. Some of the things contradict previous guidelines. For instance, when this act was first passed back on the 18th, everything was supposed to start the 2nd, I believe. DOL decided, no, we'll start it on the 1st. And they made that decision middle of last week, I believe. So that's just an example of where we are at this point. Now, we expect everything to firm up as the month continues. Next slide, please. Takeaway. All right. First, all employers need to be prepared. Already the requirement for the medical leave, part of it is already in place in the sense that schools are all closed in the state. Now you need to be able, your employee needs to be able to show that they're unable to work or telework because of this. So as my example before, when you have the high school student who can take care of themselves sitting at home, and the parent's job allows them to telework, they don't qualify. But if you have somebody who works at a manufacturing plant and their child care for their 6-year-old is gone and they need to go on leave, they qualify for that at this point. As for sick leave, same thing. Now, one interesting note, if you've watched CNN recently, you know that Chris Cuomo is now self-quarantined in his basement, and he's able to do his job, so I don't think he qualifies. But if you have somebody who is so sick that they can't get out of bed, they would qualify. And once again, I want to stress, the situation is constantly changing, and there is a moving goal point or post at this point. One of the things that's interesting is that this act technically ends December 31st. If this goes on as long as some naysayers and doomsayers are saying, we might see modifications of the end date at this point. Also, if the pandemic just magically disappears next week, which I'm not saying it will, but if it was to do so, then all of this would be obsolete at that point. Next slide, please. Any questions? It doesn't look like we have any questions.
Hey, I just quickly want to say that thank you so much for Reese and Peg for putting this presentation together. Something that did just go into effect on Wednesday, and as they mentioned, is constantly changing as the situation changes. I am going to say that if you would like, you can submit a question in the chat bar on the side, or since it is a smaller group, feel free to unmute yourself and ask a question. I know Peg was about to say something. I do apologize, Peg, for cutting you off, but you are free to say something as well.
Hi, guys. This is Charles Lyman with Paul Davis. I just want to say to Peg and Reese, phenomenal presentation, well executed. The material couldn't be more poignant for what we're going through, and appreciate the accuracy and the information and letting us all be aware of this constantly, as this constantly becomes fluid and is changing on a daily basis. So thank you for the excellent information and the opportunity.
Thank you very much, Charles.
Thanks, Charles. If there are no other questions, let me just point out something. One of the trickiest things about this can be to figure out what you need to pay part-time employees. If they have a regular schedule, like we were talking about 35 hours a week, then you pay them 2 weeks, up to 2 weeks at their regular rate for the paid sick leave. And then, with the caps in place and with the reduction to 2/3 if it's for childcare reasons. But if you have part-timers who work fluctuating work weeks, then that paid sick leave for those employees, and in fact, if you have full-timers who work fluctuating work weeks, then the FMLA weeks for the pay for them are also a little trickier. And what the what the U.S. Department of Labor is telling us all to do is average what their work day was over the last 6 months or the period of full employment, whichever is shorter, and then use that as the work week basis. For the sick leave part, they're saying because for part-timers it's 2 weeks, then it is that daily rate times 14, because there are 14 days in 2 weeks. Doesn't make a heck of a lot of sense to me, but that's what they have required. So that's a real challenge that we're helping a lot of employers figure out. I see we have a question that someone wrote in. I'm going to ask Reese to tell me what that says, because I can't read things that small.
It's just it's our background.
Yeah, so I did put some information about how to contact you if you have further questions. Please do reach out to them. You can go to mitchellandsheahan.com and find out more. I believe you put together kind of a document of 10 questions that were commonly asked around these types of situations. I know they're on our website, brbc.org. So feel free to use that as a resource as well. So it wasn't another question, but if anybody does have a question, we still have a little bit of time. And again, I do thank you, Reese and Peg, for being here and for sharing all this information with us.
It was our pleasure.
All right, it doesn't look like we have too many more questions. Again, last chance. Julie says thank you, so thank you again. I believe we did record this. We are going to try and see if there's a way for us to share this recording for folks that might not have been able to make the call. I do appreciate you all for working through this one for a couple little technical difficulties, but thank you for your patience. And again, Peg and Reese, thank you again. And I believe this is the end of our presentation.
Thank you very much and have a great day, everybody.